Hi, I'm Suzanne Bowe. I'm doing the Nursing One Skills Validation for performing an enema. The first thing you want to do is fill your bag with water. It's about 105 degrees. You can check that on the inside of your wrist. Make sure it's not too hot. For the sake of this video, I'm just going to go ahead and fill this with 500 milliliters. But for an adult, you need about 1,000 milliliters. And again, an enema is used to, before surgery, to clean out their system before surgery. Or if they're constipated, you would use an enema also. Okay, I think that's pretty good. Again, you would look at the clamp. It's closing on. I'd open it to make sure it goes to the end. It's working okay. And then for the sake of this video, you would have a pole that you would hang this on, but I'm just going to use a hanger. Okay. Now we're going to go ahead and go to the patient's room. Before I went into the patient's room, I would go ahead and check the MAR and the doctor's order, and I would perform my first check to make sure that I had the correct patient, the correct dose, drug, and so on. And then upon entering the room, I'd say, "Hi, Mrs. Smith, I'm Suzanne, I'm your nurse. I'm going to be giving you an enema today. Do you have any questions?" And if she did, I'd answer them for her. If not, I would ask Mrs. Smith, I'm going to reposition you for the enema. I would go ahead and lower her bed railing, and I would raise the bed for a comfortable height for me. And then I would go ahead and make sure, of course, that the door is closed, the curtains are closed, and that she's got privacy. And at that time, I would go ahead and put a bath blanket over her, and I would remove the other covers, and then I would remove the bath blanket so that the buttocks is exposed, and I would locate the rectum and the anus, and I would make sure that I perform hand hygiene and that I have all my supplies with me. Tissue and the enema bag, of course, and some lubricant for the end of the enema. Okay, and then I would make sure that I would undrape her to expose the buttocks. She would be lying on the left side, which the Sims position, with the right leg over like this. And then I would start the enema low, and I would tell her, you may feel some pressure, and I would go ahead and lubricate the end of the tubing, and this one's already lubricated. And I would gently push in the enema tubing toward the umbilicus, and do not force it. And then I would go ahead and open the clamp so that it starts out slowly, like so. And I would just ask her if she has any discomfort or anything, and if she did, I could always clamp it off and stop it. And there are different height of enemas. A high enema is 12 inches and a regular enema is lower than that, but there are different enemas you can do. Again, there's cleansing enemas, there's mineral oil ones. Okay, once it's complete, I would close off the tubing, and then I would take a tissue, put around the tubing, and I would gently remove the tubing from the patient's anus. And then I would go ahead and, of course, at this point, the patient would be lying on their side, and I would tell them they might experience some discomfort. And if I needed to, I would wipe off any additional lubricant, and I would dispose of that in the trash. And then I'd go ahead and dispose of my gloves, and then I would have them positioned comfortably, and I'd tell them to keep lying on their side. I'd give them their call light and tell them to go ahead and give me a call when they feel ready that they need to use the bedpan, bedside commode, or the toilet. And after I come back, if the patient did have a bedpan, I would go ahead and remove the bedpan, and then I would go to the bathroom and I would look at the feces in the bedpan to evaluate them. And then I'd go back to the patient, who'd be, of course, on her back now and sitting up, and I'd say, do you feel better? And they said yes. And then I'd say, okay. And then I would also palpate their abdomen for any distension or discomfort. And then I would ask them if they have any other questions and if they're comfortable, and then I would leave it at that. This ends the Enema Administration.